Hello everyone, I am Dr. Niti Raizada. I work as a medical oncologist and a hemato-oncologist in Bangalore. Today I would like to discuss a very important and relevant topic, that is esophageal cancer, which is food pipe cancer, and stomach cancer, which is gastric cancer. Well, the number of these two cancers are rising significantly in our country. Especially there are pockets of certain geographies, especially South India and Northeast India, which have significantly high number of esophageal cancer and gastric cancer. Why do we need to know about them? Well, these cancers affect the way we eat, the way we digest, and how we live our life. And of course, if you come with these cancer at a later stage, they are not curable. So what is important is to realize what are your risk factors, to understand these cancers on time and come at the right time when they are treatable and often curable. Now let us discuss some of the risk factors which can cause gastric and esophageal cancer. Starting from gastric cancer, which is stomach cancer, the most common association is with a type of bacterial infection called as Helicobacter pylori. Chronic atrophic gastritis is another association. Certain type of nutritional deficiency which can happen because of prolonged low intake of fruits and vegetables is another important cause. There are certain familial factors like hereditary gastric syndrome or Lynch syndrome which can again cause gastric cancer. When we look at esophageal cancer or food pipe cancer, the most common association is with tobacco. Now this tobacco can either be smoked tobacco or it could be paan or it could be gutkha, that is chewed tobacco as well. And when you add alcohol to it, it's not additive but it's a multiplicative increased risk. Then secondly, chronic reflux. If you have Barrett's esophagus which causes chronic reflux is also an important association. Besides this, well, if you have uncontrolled obesity which can again lead to chronic reflux, low fruits and vegetable ingestion, and of course certain other factors like accidental caustic ingestion can also cause. So what we understand is that stomach and esophageal cancer both are a lifestyle disease as well. Now let's look at symptoms which we should not ignore. So if there is a suspicion of esophageal cancer, most often a patient would have difficulty in swallowing solids. It's known as dysphagia. It could be painful deglutition or painful swallowing, and because of constant inability to eat properly, there could be weight loss. When we look at stomach cancer, often a patient would have long-standing indigestion or difficulty in digesting food and bloating sensation immediately post-food. They can also be vomiting, and often vomiting can be associated with blackish vomitus which is known as hematemesis. They can be blackish stools which is known as melena, and often the patient would have anemia which causes fatigue and again weight loss because of indigestion. So if any one of your family member or your friend has chronic symptoms of about 2 to 3 weeks which are of the nature I mentioned, please visit a doctor. Now how do we diagnose these conditions? Well, if a person presents with dysphagia or chronic gastritis or acid reflux, we often would want to do an endoscopy. Endoscopy has a small camera which views the food pipe and the stomach, and if there is any growth seen in these areas, we would want to take a biopsy which is like a tissue extract, in which first is we see pathology, what is the histopathology of that tumor. And then once we have established whether it's a squamous cell carcinoma or an adenocarcinoma, often we would want to do special test known as an immunohistochemistry. So once cancer is confirmed, often the next step is staging the cancer. And the staging involves either an ultrasound, which is normally a preliminary investigation. However, a specific investigation would be a CT scan with contrast of the abdomen and often of the chest. We would want to sometimes do a whole body PET scan, which again is a functional and anatomical image which tells us where is the lesion and is there any spread in the lymph nodes or any other organ like lymph node which are non-regional or lung or liver. Now once we have established the type of cancer and the stage, then the treatment is planned, often in a multidisciplinary team meeting where all the subspecialists are there, including surgical specialists, medical specialists and radiation specialists. These are the 3 arms of oncology. And often when we are treating an esophageal cancer which is not spread anywhere, we normally start with chemoradiation as the upfront modality, and then subsequently if it is resectable, consider surgery. There are certain areas of the esophagus like cervical esophagus or upper part of the upper esophagus which is very difficult to resect, where definitive chemoradiation is the modality of choice. If a food pipe cancer or an esophageal cancer is not resectable, then often systemic therapies like chemotherapies are delivered. In a stomach cancer, again, whether it's early cancer or it's locally advanced cancer or it's metastatic cancer, based on these stages, a treatment is determined, which could involve a neoadjuvant chemotherapy, which are a combination of drugs given prior to surgery. A surgery may be offered, and in a certain subset of patients, radiation may be offered as well. Subsequently, adjuvant therapy or post-surgery chemotherapy is often given. These patients also undergo special type of testing on the tissue known as immunohistochemistry, which tells us whether newer type of drugs or biologic therapies can be given. So a HER2 expressing gastric cancer can actually benefit from trastuzumab. A certain type of metastatic conditions may benefit from immunotherapy, which are again drugs, and we often see whether immunotherapy will work or not by doing a test known as PD-L1 testing on the tissue. A certain subset of esophageal cancer may require maintenance immunotherapy as well. So these are some of the latest advances of managing stomach cancer and esophageal cancer. So while I say all this, my message is very simple. Try to understand what are the medical issues you have. If there's any difficulty in swallowing, if there's any unexplained weight loss, if there's persistent acidity, please visit a doctor. Whatever you can avoid is pickled food, smoked food, treated food or preserved food for a long time. Make sure your diet is rich in fruits and vegetables. If possible, please avoid addictions. They are known to be carcinogen, whether it's tobacco or it's alcohol. If you have a strong family history of either esophageal cancer, gastric cancer or some other cancer, please visit an oncologist. Make sure your history is evaluated. In certain cases, a check endoscopy is prescribed at a certain interval to look for certain precancerous growth which can be treated. Please understand that these are curable cancers if treated on time. If there's any need, please meet me. I'll be happy to serve. Thanks so much.